The goal of the Scottsdale Center for Women's Health is to provide outstanding OB/GYN and gynecological services while offering new and advanced treatment options that may not be available at other offices. Joining me now is Dr. Russell Bartels. It's good to see you, Dr. Bartels. Thanks for joining us. The first thing we were going to talk about is a way for a woman to get permanent birth control. And it's something called Essure?
Correct, the Essure procedure. It's relatively new in the media, and women are hearing about it more. But it's actually a procedure that we've been performing for about 7 years or so.
Oh.
And so it's nice to see this great option being popularized and women asking for it by name now. But it's a very simple procedure, often done in the office with no incisions, compared to the older form of laparoscopic tubal ligation, which was an invasive procedure under general anesthesia. And now we're able to bring a permanent sterilization procedure into the office with no incisions by placing through the cervix, very gently and easily, with a little bit of sedation provided by an anesthesiologist, very safe in the office. And we place a little coil in each fallopian tube. And over 3 months' time, the fallopian tubes close over those little coils, and your permanent birth control is achieved. And so during those 3 months, you need a backup form, but once it's determined that in 3 months, it's good to go. And it's a very easy office procedure to do, usually a $30 copay or whatever your copay would be to come in and see me for a regular visit.
Can anybody do this procedure? Who's a candidate?
Pretty much anybody is a candidate for this procedure, and in fact it's a great alternative for patients who are a surgical risk where they really shouldn't have a procedure in their belly, patients who are tired or don't want it or can't be on hormonal forms of birth control. So it really is a good opportunity, a good option for women searching for permanent birth control.
Is there any downtime with this, or are they
virtually no downtime? I remember when we first started doing these procedures several years back. I remember getting the call from the patient later that day, going, "Oh," I'm thinking, well, what might have happened? And she said, "Can I go out dancing tonight?" And I said, "Yes, you can if you want." So there's really minimal downtime, virtually no pain during the procedure. And really no downtime. It's quite a remarkable procedure.
That's amazing how far we've come with technology. What about with heavy menstrual bleeding? I know there's so many things you can do for that.
Very common problem. And for women who are done with fertility, they don't want any more children, okay, there's a great procedure called an endometrial ablation. There's different ways of accomplishing this, different technologies. By name, they're ThermaChoice, NovaSure. Those are the two that we provide in our office. But they're good at reducing or completely getting rid of menstrual flow. Nothing hormonal. The hormones are still the same, and that's a good question a lot of women ask is, are my hormones going to change after this procedure? The answer is absolutely not. So we kind of cauterize the inner surface of the uterus with these devices in the office, again, under some light sedation and a little bit of cramping, easily controlled with Motrin, maybe a pain pill.
After the procedure, right?
Yeah, for that evening into the next day or two, a little cramping, but very well tolerated. And the patient satisfaction on the endometrial ablation and the Essure procedure is just sky high. We can't promise never a drop of blood again, but we can take a problem and make it not a problem. And there are a fair amount, maybe 30 to 40% of women, maybe it's even higher perhaps, that won't ever bleed again. We just can't predict those.
Wow. Will insurance cover that procedure?
Insurance covers both these procedures, and again, for many patients, it's whatever they would pay for a copay to just come in and discuss these problems.
Wow. I know a lot of people would be interested. That's very good information. Thanks for informing us about that. Some of the things that you can find when you go over to your facility. Thank you for joining us and explaining those procedures. And if you do want more information on anything that Dr. Bartels discussed, you can visit him at ScottsdaleOBGYNS.com. There is the phone number on your screen. It's Scottsdale Center for Women's Health.